Today we're going to talk about wound care and the basics of wound care for our information education project. Considering how we evaluate a patient comes greatly and more in depth as you are experienced in the nursing field. We have to determine what a wound is, what type the wound is, how it was originated, how we treat the wound, what would we do to change our care plan to heal the wound, how we would prevent further wounds, and what increases the risk of how people actually develop the wounds ongoing. Do we need to change their lifestyle? Wounds come in two types, both chronic and acute. Chronic wounds take weeks or months to resolve, while acute wounds usually heal within 2 weeks. If an acute wound does not heal in 2 weeks, then it becomes a chronic wound. Pressure wounds are identified in stages. Stage 1 being intact skin that is non-blanchable. It's typically found on a bony prominent area on someone who's been sitting or lying in the same position for a long duration. Stage 2 wounds is identified as intact skin that maybe is peeling or sloughing at the time. The first layer of skin is typically the only layer that's impacted. Stage 3 wounds are affected deeper. You may see fat tissue exposed or have more visualization of underlying tissue. Stage 4 wounds involve deeper structures such as bone or tendons. And an unstageable wound is identified when it is covered by eschar and you can't see under the eschar or dead tissue. Next, we consider how we measure the wound. Wounds can be measured in various forms and locations. It's important to consider the patient's anatomical position. You can use devices such as these paper tapes that are measured in centimeters, or a cotton tip applicator, which is useful for measuring under the tissue and maybe assessing for tunneling. So we identify our stages of the wound, we measure the wound, and then we consider the treatment with another aspect to review. What does the tissue look like? Is it granulated, beefy red like ground beef? Is it necrotic, yellow slough or eschar? Is there undermining where the tissue separates from the surface? Do we have tunneling where there are spaces going around the edges under interstitial spaces and undermining that's deep into the tissue? How much drainage is there? And is there an odor? We consider the peri wound, what it looks like. Is it moist or dry? Is it warm or cool? Multiple factors affect this space, and we need to consider treatment if the tissue looks non-viable. So we go through various stages of wound development and treatment for people that have chronic wounds today. Oftentimes we use a simple dressing with foam to reduce pressure to bony prominent areas or to contain a wound because these seal very nicely. That is an Optifoam. We have foam without edges that's hydrophilic, which will absorb drainage. We have antimicrobial wound care such as MediHoney or Hydrogel. Both are utilized when there's negative tissue involved. We have Iodoflex or iodo packing when there's microorganisms in the wound that we want to get rid of. And we have absorbent pads such as an ABD or gauze, both which absorb extra drainage. At the end stages, we might use something that's called collagen, and that promotes the end stages of healing when a wound needs just a little extra nutrients. And we also use this spray when we are cleaning wounds, which is just normal saline, and our bodies seem to like that most. Wound care should be performed in the technique that it is ordered. We should consider using sterile or clean technique and always follow the doctor's orders when we complete the care. Thank you.